Hello, it's Dr. Jack Wolfson, board certified cardiologist, and welcome to another edition of the Healthy Heart Show. And when it comes to heart health, there's not much more important than dentistry, but holistic dentistry is the key. Holistic, biologic, whatever you want to call it. This is what we need to discuss because heart disease and oral health play hand in hand so well. And that's why I brought on Dr. Stuart Nunnally on to the Healthy Heart Show. Dr. Nunnally, if you don't know him, you haven't been paying attention to the oral health summits and all the different programs that are out there and YouTube videos and all the different ways you can get access to Dr. Nunnally. He is board certified in integrative biologic dental medicine, board certified naturopathic medical doctor, and he has all these different fellowships and once again, content on the internet. I'll let Dr. Stuart go ahead and introduce yourself. Stuart, welcome to the Healthy Heart Show.
Thanks, Jack. It's a joy to be with you today. We're having a great day in Central Texas.
Oh, I'm sure. Especially, we're recording this time of year, and some people, from my hometown of Chicago, they're getting blasted with cold. And it's not even so much of the cold, it's the fact that it's cold and there's just no sunshine. So that's a recipe for disaster, that lack of sunshine.
Truly.
Tell me some of your history. Why did you become a dentist, a naturopathic medical doctor? And as far as kind of like, most dentists are certainly, I wouldn't say they're holistic or biologic. So kind of tell me how you're different.
Well, I had to get into this line of dentistry by default, and that is I got sick, and I, as a result of my illness, which was 16 years ago, I made the career move from traditional dentistry to holistic dentistry, and here's what happened. I began to have neuromuscular issues. 16 years ago, I was incredibly fit and a competitive triathlete. And all of a sudden, I began to have lots of weakness, particularly on my left side, and muscle fasciculations, which are twitching muscles that people can see. Most often we see them around our eyes, but I began to fasciculate in every muscle in my body from the bottom of my feet to the top of my head. And after many months of seeing a neurologist, I was finally referred to the Lou Gehrig Center in Houston, and we were all convinced I had ALS. I was convinced of it for sure. As it turns out, I had a mercury toxicity issue. I hadn't put a mercury filling in 20 years, Jack, at the time, and I had always considered myself a holistic dentist, but honestly, I didn't really know what holistic dentistry was all about at that time. I had a master's in nutrition, so I was intensely interested in nutrition and doing those things to help me from a competitive standpoint, especially in triathlons. But I was really not practicing from a holistic standpoint in dentistry. I was removing mercury fillings, but taking no precaution myself. And
well, let me ask you this. Why did you stop doing mercury amalgams? Obviously, there's a lot of dentists that are still putting in mercury amalgams. They'll go to their grave literally early because, believing that there's no problem with mercury amalgams. Why did you decide that 20 years earlier?
Well, I had been a chemistry teacher, and I knew that when you mixed metals together, they didn't all stay together. Metals do not react in a strong fashion. They tend to disassociate. So I knew that mercury leached out of these fillings, even though we were taught in my dental training that it did not. And so as a result of the aesthetic issue, as a result of the fact that mercury fillings tend to crack teeth over time, and as a result of honestly knowing better, I abandoned mercury fillings early on in my practice.
Where can you give us a little insight as to, let me say this, from a heart standpoint, I've got a whole chapter in my book, and the chapter is called Heavy Metal Madness, because I want people to understand that it is evidence-based. It's all over the literature that mercury leads to cardiovascular disease, and of course, as you found out, brain disease. And the medical doctors give you the label of Lou Gehrig's, they give it, the label of ALS. But as you quickly found out, you weren't born to get that. Something caused that constellation of symptoms, and it sounds like a lot of that for you was mercury. But where did mercury start with dentistry?
It started hundreds of years ago, and it was used because it was a cheap filling material. Mercury, when it's mixed with the other four constituents, and that's tin, silver, copper, and zinc, when that's mixed, it's an amazing mixture, and a blind idiot can put it in a tooth. It just takes almost no skill whatsoever. That's why you can have people all around the world who place these mercury fillings who have had very, very little dental training. You just simply stuff it in the tooth, and there it sits, and it's not going to fall out until all the mercury leaches out of it, which is a long time from now. So as a result, it was used because it was cheap and because it was easy to place and lasted a long time. That's what happened. And there's been fight after fight over this in dentistry for the last several hundred years as to whether not only is it safe, but does it cause more harm than it does good by the fact that it cracks teeth. If you stick a hard metal down in the middle of a tooth and you hit on it repeatedly for years and years, you tend to crack teeth. It's honestly one of the things that keeps dentists in business. You put the filling in when the child is 8 or 10, and then the tooth cracks when they're 35, and then you do the crown. And then you get to do the root canal a few years later. It's one of those things, in my opinion, that perpetuates itself.
Well, and that's obviously like cardiovascular disease as well. In my line of work, how, somebody comes in, angioplasty, stent, and then a few months or even years later, they'll need another angioplasty and stent, and then they'll eventually need bypass and a pacemaker. It is like this annuity, and all along the way, the cardiologists are doing stress tests on these people and other tests, that people don't need. Let me ask you, so not only does metal filling, obviously the major constituent there is mercury, or at least 50% of it, let's just say, is mercury. So it compromises the integrity of the tooth. That's one negative thing. But the common thing I would think that people are concerned about is the leaching of the mercury from the amalgam into the body. Tell me, what is the evidence that that is the case?
To me, that's the real issue. And it's substantiated in the peer-reviewed literature over and over again. The organization which I maybe admire most in my own profession is the International Academy of Oral Medicine and Toxicology, IAOMT.org. And if you were to go to their website, as anyone can go and see the library there that has close to 1,000 documented peer-reviewed references on the impact of mercury in our systemic health. Much of that literature in that library being just associated with dentistry, just dentistry, the mercury amalgam that comes off of those fillings and its impact on our systemic health. It's one of the reasons why, Jack, it's one of the reasons why I had the issues that I did neurologically. And it's one of the reasons why dentists have one of the worst track records of all professions, has the worst track record, health-wise, of all professions. We're number one in divorce, suicide, depression, cardiovascular disease. We're way up there. It's because, in my opinion, of the exposure to mercury.
Okay, so we agree that obviously the literature says that mercury is getting into the system. It's getting certainly into the brain, leading to inflammation of brain, cardiovascular tissue. I assume there's links to cancer and everything else that's there. So if people are listening and now they agree that mercury is bad, the amalgams are bad, they're convinced of that, should everyone get their mercury amalgams taken out?
Probably not, for several reasons. One is I have elderly patients who are robustly healthy. They've had mercury fillings for years. They're fine. They're doing well. We have other patients, of course, who report having one mercury filling, doing nothing else to their known ability. They can't recall anything else. And these patients have a neurological event afterwards. It may be something like MS. It may be something like lupus. It may be something, some bizarre autoimmune issue. It may be heart disease, and no one can put their finger on it. And we all know the literature in terms of the mercury's um, predilection for heart tissue and for neurological tissue. So your question is a great question. Should the general public rush out and get their mercury fillings out? I would say if their dentist is accustomed to removing these in a safe manner, then absolutely. And there is a protocol that's been established by the IAOMT. And again, you could go to that website, IAOMT.org, and you can search for a SMART certified dentist. SMART is an acronym for Safe Mercury Amalgam Removal Technique. Every dentist that's SMART certified has gone through the training process and should be doing this properly in his or her office to make sure that the patient doesn't suffer a mercury exposure when the mercury amalgam fillings are removed, because if they are not removed in a safe way, the patient is exposed to a higher level of mercury than if the fillings were left alone.
Okay, well, and I definitely want to get to your explanation of that with how it should be done in the appropriate way. But I do want to ask you, once again, there's plenty of 75-year-olds that are out there, 65-year-olds that are out there that say, why would I get my amalgams removed? They've been there for 45 years. I feel fantastic. I don't have heart disease. I don't have cancer. But Stuart, I'm sure you would agree with this. Everybody is healthy until they wake up one day and they're not. So if we want to be proactive, is it not best to have them removed?
Of course it is. I grew up, Jack, in a house that was built with all kinds of asbestos in it. As far as I know, I have no asbestosis or mesothelioma. As far as I know, my lungs are clear. But would I want to move into a house that still had asbestos in it? Or if I lived in one now, would I continue to do that? Wouldn't I do something about it? Of course I would. We know the issue. Would I live in a house that had lead-based paint? No, I wouldn't. So there are this common sense things that we would do. No one today, knowing that a mercury amalgam filling is 50% mercury, if they really knew it, I don't think anyone today would say, well, go ahead and put a little dose of mercury in my teeth today, because maybe I'll just beat the odds.
Can you imagine that, the medical poobahs that are out there, the medical authorities, everybody would say that mercury is dangerous, right? Mercury used to be in the sphygmomanometer. Mercury was, in light bulbs. And if a light bulb breaks, you've got to basically call in like a hazmat team. But for some reason, mercury is safe when put in the mouth or inside of a vaccine.
No, absolutely. Now let's take it a step further. If you had a mercury filling and you came into my office today and I removed it safely, all the pieces that I took out of that tooth would be put into a special jar and it would be hauled off by someone who has a hazmat license. Now, does that make any sense? It's one of the most remarkable things in all of medicine or dentistry.
Scary. Okay, so obviously there's online videos that people can see of you and others performing safe amalgam removal. Can you maybe give us a couple things on what our listeners could look for or question their own dentist with? Now, like you said, the obvious thing is go to the website, find the holistic biologic dentist, and then ask them the question. So starting with that kind of group of people, right? And then asking them to, hey, tell us what the protocol is. Can you describe some of the protocol?
Sure. The most important thing would be the fact that when the dentist sits down to do the dentistry, after that patient is numb, they would put a rubber mask over the tooth. That's known as a rubber dam. It isolates the tooth and it keeps the particulate that's drilled out from going down the hatch and the patient being exposed systemically. Then the patient would also be draped. In fact, in our office, no part of the patient's skin is exposed. Hair, every millimeter of the patient is draped and covered, because some of the particulate does escape into the room. And for that matter, my staff and I are completely draped. So if you, in my opinion, if a patient goes in and they don't see or experience a rubber dam over the tooth, or if the dentist says, yes, I protect you, but I don't feel the need to put anything on, that would raise a red flag for me. One other thing would raise a red flag for me, and that is if the patient said, well, what happens to all of the mercury waste that goes into your suction here at the office? Does that just go into our municipal water supply?
Oh, God.
Well, the truth of the matter is, in most places, it does. We as dentists are one of the largest contributors to environmental mercury burden that there is. So you would want to say, if he says no, of course we just suction it right up. So you don't have a mercury amalgam trap on your vacuum devices so that you collect the mercury amalgam. That would be a question for me that I would want to ask.
Wow. Wow. What about, I guess, and what about for people that maybe have amalgam under a cap or a crown? How would people best be able to find that out if there's mercury under one of those, which a lot of dentists would say, well, it's safe now, it's enclosed and it's encased, right?
Of course, and that's the typical response, because we, as dentists, we forget our chemistry and our biochemistry after we graduate. And but the truth of the matter is, there is no barrier to mercury. So that when we encase it with a crown, it just simply percolates through the tooth into the surrounding tissues. That's very well documented, actually, in the literature. So that what we would say to that patient who wants to know is, there is actually a meter. It's an amp meter. It's a microamp meter. It measures a current in millionths of an amp. And so we can literally take that amp meter, we can put it on the tooth. In most places, it's known as a RITA, R-I-T-A meter. And this little meter will go onto the tooth, and you can measure literally the current that's coming off of that. At a certain current, we have a very high predictability of whether there's mercury underneath that crown or not. And interestingly enough, there are some crowns that are translucent enough that on an X-ray, you can actually see the mercury filling still underneath it.
Would a cone beam CT be able to pick that up?
Not typically.
Not typically.
Yes. We like a cone beam, and certainly we use it routinely, but it's not great for that.
Okay. And we'll definitely get to cone beam. Stuart, I got to thank you for being on, because I promised this was going to be a somewhat short episode, but I'm afraid I lied. I got a lot of things that I want to ask of you. So if we're cool, because this is all so critical that people just they just don't understand how important the teeth are to total health. And if anyone's listening to this with children and grandchildren, please make sure to take care of those children's teeth now, before they are literally screwed as an adult, right, Doc?
Oh, now as a grandparent, it just makes me cringe to think about one of my grandchildren having some kind of a mercury assault, whether it would come from a filling or whether it would come from a vaccine. It just would absolutely, it just petrifies me to think of that.
Tell me about this. Tell me, how detrimental is sugar consumption for the child? I was at an event a few years back, and it was a fundraiser for John McCain, and it was co-sponsored by Delta Dental Insurance. And Delta Dental, it was basically, they had like a three-pronged approach that they said they were doing for children's oral health and wellness. Okay, one was regular dental checkups. Number two was fluoride in the water. And then number three was regular brushing and flossing. Not one of those three had to do with the child's diet.
Exactly. Well, and that's where it starts. Jack, we would, Delta Dental and I would probably run about as, we wouldn't agree on too many things. And the first thing is we wouldn't ever want to expose a child to fluoride, mainly because fluoride is such a incredibly active element. It is the most active element on our entire periodic table. And it loves to compete with that child's iodine for the child's thyroid. And we can go on and on and on. So we would never want to expose a child to especially to the amounts of fluoride that you would get in a typical dental office. And even worse than that would be to expose them daily to the fluoride that's put into a municipal water supply. To doctor up our municipal water supply with a known poison, a toxin, which fluorine is, and to then suggest that we all would drink that when it actually, believe it or not, has no impact whatsoever on caries. Now, we've all been led down this path to believe that fluoride in our municipal water supply prevents caries. It does not. There's only one peer-reviewed paper ever that showed the possibility that it did, but there have been multiple papers to demonstrate that fluoride applied in a systemically by drinking it does not impact our incidence of decay. It does impact other issues, like including causing fluorosis of the teeth, including fluorosis of the bones, including osteosarcoma, especially in young boys. There are a number of issues, including lowered IQs for people who ingest fluoride. So fluoride would not be one of the things that I would recommend at all. But instead of devoting that time, the time the hygienist would spend delivering a fluoride tray, if she spent that time with the mom and child, suggesting that maybe today we eliminate sugar from the diet, maybe we don't have a Coke a day, maybe we do, water with a little stevia in it or something. We have so many things we could do to improve decay issues and health issues rather than what we've done traditionally.
I mean, can you imagine myself and all the other millions of children that would sit in that dental office? I can remember it, of course, Doc, like it was yesterday, with the fluoride tray, and you got to pick your different flavors. Mm-hmm. And then, of course, that was after they filled one of your cavities, and they gave you the fluoride tray. And then you got this little piece of paper from the dentist that said, good for one free ice cream cone.
But the other thing they said is be sure and don't swallow this. Make sure you spit it out. Because one of the major reasons for children to be admitted to ERs in this country is ingestion of fluoride.
Wow. And then, and I know that I haven't really looked into the links of the fluoride usage and increased cardiovascular risk. I know that they are, I know if we dig enough, we will find those links, and I'll probably do a blog post on that, and I'll send it to you, for review and commentary as well. But how all that plays out, and that's undoubtedly true. Tell me about root canals. Obviously, root canals happen so often. There's a whole profession of dentistry that's all they do is root canals. They will defend that, of course, to their grave as well. And then tell me kind of the general issues, with root canals. And then, and I want to ask, did you ever see the movie Root Cause?
I did see the movie Root Cause, and was interviewed for that movie. And so, yes, I'm very familiar with it.
Of course. I mean, I know that, Tom Levy had so much screen time, and it was kind of a funny movie. And I'm sure you remember that one scene where he talks about how he sees like 50 different providers for his health problem. He's going to a shaman, and he's going to a massage therapist, and he's going to, some other like Buddhist monks, and like he's done everything. Mm-hmm. And so those of us that have been around people that have done everything, including patients and family members, and then to see this guy up on screen go through that whole litany, it was hilarious. But you were in Root Cause, and everybody should go see that movie, right?
Well, I think so. I do think so. I think the producer editor of that, who's an Australian, did actually a fabulous job on conveying that story. And it's not an easy story to tell. There's a lot of emotion in that story for many, many people. Tom Levy, who you just mentioned, had a life-changing experience after he had his root canal teeth removed. And of course, he's a cardiologist. He's written a fabulous new book called Hidden Epidemic. I think it's one of the most well-documented books that we have in dentistry in the last few years. It has many, many peer-reviewed references in terms of the infections, the systemic health issues related to root canal treated teeth. So a root canal treated tooth is a tooth that's had the nerve and blood vessels removed. And so most times it does a pretty good job of eliminating the pain in the tooth. Typically, these are infected teeth. The root canal relieves the pain because the nerve is removed from the tooth and so is the blood supply. The problem is that there are many miles, intricate miles of little microtubules that the dentist cannot get to. And
miles.
So,
you
miles.
Just said miles.
Yes.
Miles of tunnels and tubules that the dentist cannot get to. Thank you. Okay.
Yes, a single rooted tooth has 2 to 3 miles of microscopic tubes. It looks under a transmission electron microscope, it looks like honeycomb. There are so many porosities in teeth. We think of them as being hard as a rock and like a piece of granite. Well, they're not. They're honeycomb. And so now you've eliminated through the root canal procedure, you've eliminated the body's own mechanism of cleaning this tooth up because you've severed the blood supply to it through the root canal treatment in itself. So you're left still with a tooth that has bacteria in it. There's no known way today. There's no known way to sterilize a root canal system. It may be, for example, that ozone, when ozone is injected into teeth, root canal treated teeth or around teeth, that it helps eliminate the bacteria. Maybe it eliminates all of them. We don't have a good study to show that. But if the tooth is left unchecked, dead in the mouth, there are plenty of bacteria that can again re-infiltrate this tooth and reinfect it. So we don't know yet whether ozone completely eliminates. We know that it helps, but we don't know whether that, for example, helps eliminate the infected tooth. We know that antibiotics will only work on a very temporary basis because you cannot deliver them into the tooth. There's no blood supply. That's the problem with root canal treated teeth, is that the bacteria sit there, they have a heyday, and their end products, which are exotoxins, will then pass out through the tooth. They get into our systemic circulation and they can cause a whole host of problems. Most dentists don't want to acknowledge that fact. I was one of them, Jack. I did hundreds of root canals until 17 years ago, and I became acquainted with the literature associated with this. And I read for the first time Weston Price's book, 1,200 pages on this issue of root canal or infected teeth and systemic health issues. I couldn't believe it.
Yeah, Weston A. Price, you should be like, when you go into dental school, I mean, that should be like the first book that you read, almost as much as when I went into osteopathic medical school. I wish somebody would have stood up in front of the class and said, we're going to teach you about 20 different skin lesions and 15 forms of hepatitis and 20 different forms of cardiomyopathy. But we want you to know that all illness, all disease is because of poor nutrition and environmental, pollutants and an unhealthy lifestyle. Wouldn't that have been amazing if they would have said that in the beginning of your training as well?
Oh my goodness. And if as much time had been devoted to that as it was pharmaceuticals, just think how enlightening it would have been.
Amazing. And just reading his book, and that's why, I quickly gravitated towards, my book is called The Paleo Cardiologist, The Natural Way to Heart Health. It is about eating like the wisdom of our ancestors. And that's what, when everybody talks about all these different diets and should we go vegan? Should we go keto? Should we go Mediterranean? It's like Weston A. Price documented it. The explorers, Captain Cook and Magellan, they documented how these native populations ate. Why do we have to try and reinvent the diet if we just follow Mother Nature?
Isn't that the truth? And you and I have seen this, Jack, time and time again. The healthiest patients that I see in my practice are those who really have followed their ancestral diet. So if I see an Asian in my practice who has adopted a European diet here, a diet that's high in meats and saturated fats and those sorts of things, they'd have a tough time, and vice versa. If I take a good old Texas boy whose ancestors came from Germany, and you try to put that patient on a high carb diet, I'm talking about a complex carb diet. I'm talking about, say, a diet that's common to those in the Philippines.
Yeah.
Well, he doesn't do well on that either. And so I like the fact, I love what Weston Price discovered. And that is when people stay on their indigenous diets, they thrive. They have great, strong skeletons. They have a jaw that will accommodate all of their teeth, and they thrive. It's when of course, in America, we've adopted our own special, sad American diet, which is pitiful for any culture. But yes, nutrition is the number one most important things in terms of dental issues and, I think, systemic health issues.
Totally agree. So somebody with a root canal, who gets them removed? Does everybody get the root canal? Because obviously having a metal amalgam removed or several, that's something you can sell to a patient. I can sell to a patient, say, listen, I got to get you to a holistic dentist and have that done. But now you start talking about teeth, tooth removal,
Yes.
you start getting some pushback.
You do, and I don't blame them, because when we remove a tooth, you're presented with a whole new set of problems, and you have to weigh the trade-off. In my opinion, would I have a root canal treated tooth? Absolutely not. I would not. I had done one for my wife 25 years before I knew the research, and of course we removed that tooth because I could restore it in a way, and she has a beautiful little bridge in there, and she doesn't even know she had a tooth removed now. But it's not always that simple. Or what if someone has 6 root canal treated teeth? What if, like today, I just got a cone beam on a patient with 14 root canal treated teeth? What are we going to do? What are we going to do for this lady? Now she can barely get out of bed. And is it can we attribute that to her root canal treated teeth? Well, the truth of the matter is we can't unless we remove all of them, and then we see her have an amazing recovery. So these are not easy issues. And when you say, do we encourage every patient to have their root canal treated teeth removed? This is what I say. No, I absolutely do not. What I do is I inform my patients. I give them an incredible educational journey and let them help me and them make an informed decision. Now, will I tell them about Tom Levy's newest book? Absolutely, I'll tell them about it. And there are at least 4 very recent studies, peer-reviewed studies in there, that point very directly to root canal treated teeth and cardiovascular disease. There's another study in there, peer-reviewed study, that points to cerebral accidents. In other words, having a stroke and root canal treated teeth. And then we can go on, and we could go all the way back to Weston Price's work and say, look at this incredible body of work, the evidence that systemic health issues can result from our teeth, root canal treated teeth being one of the most toxic of all entities that we could have in our body. And yet you and I both know, I know today, I'll see someone next week who's 85 years old, robustly healthy, and has probably multiple root canal treated teeth. So we're not all impacted by the same token. I guess the biggest thing is, Jack, let's say someone presents to you, they've had an MI, they've had a heart attack, and no one has ever even thought about, could a root canal treated tooth have been either the cause or the thing that exacerbated that heart attack or caused the inflammation which led to the heart attack? The problem is there are not enough people like you who are looking at teeth as a possible issue. So it's not an easy treatment to say one person, if this person gets it, the next one's going to get it too. I want to have that discussion with them and let them make an informed decision.
Yeah, no, I definitely agree. It is not only obviously is root canal removal a lot of work, there is expense to it. And then, we'll talk about, do we do an implant? Do we do a bridge on those people? And I think, also when it comes to, cause and effect, is it causation or is it association? So the people that eventually need a root canal, done, maybe they're living the unhealthy lifestyle compared to others, and therefore it increased cardiovascular and stroke risk. But that being said, let me tell you, I guess, what my approach is for someone in general. It's to say, okay, listen, you either are at risk for cardiovascular disease or you've had cardiovascular disease. I want you to follow this diet as close as possible. I want you to live the healthiest life as close as possible. I want you to go to sleep with the sun down, awake with the sunrise, get the sunshine, get away from stress, get away from environmental pollutants and chemicals and toxins. I want you to get chiropractic care. I want you to, see a holistic dentist. I want you to do all these things. And then let's check your markers of inflammation. Yeah. And if there's still inflammation, if you're still on fire, if you're still feeling sick for those that are symptomatic, then you're the person who should have that root canal tooth removed. Trying to find maybe a little more objective evidence that, hey, we've cleaned out so much of the stuff, but there's residual problems here. It's got to be coming from the tooth.
I think that's a great approach, unless you suspect that the tooth is the direct cause of the heart issue, which occasionally, as you will see a robustly healthy person who maybe I hear or see these people all the time. They say, I've been perfectly healthy. I didn't even have any markers like elevated inflammatory markers like C-reactive protein and others. I didn't have anything elevated. I had a root canal treated tooth and I had a heart attack.
Yeah.
Now I see that patient gets referred to me a lot. And, I only wish, of course, that in these cases, I wish the surgeon, whether they did a stent or whether they did a bypass, I wish they would take a sample of that and hang on to it so that we could DNA test that against the extracted tooth and see if we can't match those bacteria up. I'm almost certain that and Levy's book points to this, that you can absolutely match those bacteria.
And I've not read Dr. Levy's book, but certainly, the bacteria that are in the mouth, they wind up in the heart. Are they innocent bystanders that are there? Are they causative? I've got no doubt that obviously the body is one, the body is all linked,
right.
So therefore, is causative. And I'm sure you've seen those cases as well, where somebody had a root canal done a month prior, they had a heart attack, and now they're seeing you, and you got that history that they were just so temporally related. So
we see it all the time.
What about are there any other methods that have significant validity to tell, out of those 14 teeth that you're talking about in your patient, can we focus in on which one or two or three are the real problem ones? Are there ways that we can look at meridians? Are there any kind of homeopathics or any kind of scans that we can use to give us some guidance on that?
Well, see, once again, and I'll refer to Levy because his book's fresh off the press, and because he makes a statement. I actually have a quote that he makes in the book. He says the vast majority of the adult population of the world has at least one significant tooth infection. He says, yet these teeth nearly always go undetected, as you and I know, and are rarely addressed. He says, nevertheless, it is these teeth, along with infected tonsils and infected gums, that cause the vast majority of heart attacks and cases of breast cancer. Now, that's a bold statement, and he backs it up. He backs it up with the research. But I will say that there are some teeth, and he makes this point in the book, that seem to be more infectious than others. And those are root canal treated teeth or non-root canal treated teeth, dead teeth, that have a radiolucent lesion on them. In other words, when you take an x-ray of these or a cone beam, you see an infection at the tip of the root of the tooth. And in this book and in the literature, that's commonly referred to as chronic apical periodontitis, or CAP, C-A-P is the acronym. So when a patient has a tooth with CAP associated with it, chronic apical periodontitis, Levy makes the point that those seem to be the most infected. Those seem to be the teeth that cause the most systemic health issues. We don't see many of those on our typical standard dental radiographs, two-dimensional x-rays like we all took for years and that most dentists still use. But when you have a cone beam x-ray taken, 40% of the x-rays that look normal to the dentist will now show CAP associated with them. 17 studies have been done to determine how often these two-dimensional x-rays are not accurate. 40% of the time in these 17 studies, there were lesions or areas of infection associated with the tooth that could not be seen with a normal x-ray. Those are the teeth that look like they cause the most problem.
Okay, so chronic apical periodontitis. What is the difference between? So would an abscess in that area be the next phase above? I mean, so an abscess would be worse than that, or are they almost like sister diagnoses?
They're sisters, and whether it's an acute abscess that's actually draining, or where the patient has swollen, or whether it's a chronic, this is really a chronic abscess. In other words, the body has sort of encapsulated this with either a little cystic lining or a very dense bone around it called condensing osteitis. Whatever the body's done to help protect you from it, it's still a chronic infection, chronic apical periodontitis.
All right, so I'm going to assume, without reading Dr. Levy's book, and I will, that Dr. Levy's saying pull the tooth.
Correct.
So whether it's CAP or we call it an abscess, the cone beam shows it, the tooth has to go. There's no way to sterilize that, right? There's no way to fix that. I mean, could people undergo a radical lifestyle change to try and save that? Or do you think once that is diagnosed, are we at the point of no return?
I think we're at the point of no return. And I hang out with a lot of holistic dentists and holistically minded physicians like yourself. We've tried lots of things like ozone injections into those areas, seen a patient repeatedly for ozone therapy. It's interesting, that does seem to help quell the infection, especially someone who has an acute infection. Let's say, for example, you're leaving tomorrow for Europe for 3 weeks, and you come into my office with a toothache, and we identify the fact that you have an abscess, or maybe you have one of these chronic lesions, a chronic apical periodontitis, and now it's become acute, and you're in pain, and you're about to get on a plane and be gone for 3 weeks, and the last thing you want to do is to have a tooth removed a few hours before you leave. What we will do in that case is we will inject ozone around that. We'll put a little anesthetic and ozone, and oftentimes that'll bring that infection right down, and the patient will be fine for weeks. but typically that reoccurs. You'll have a rebound.
Okay, so we can inject that with ozone, or not we, but you can inject that with ozone in lieu of going on antibiotics.
Yes, positively. Now, I will say as a backup, if the patient's going to Europe, I would give them a script for an antibiotic. Go get it, put it in your bag, and if this isn't gone and you're on your trip, you may have to resort to the antibiotic. We try to avoid them.
Okay. No, I'm sure you do. Any
Yeah.
experience, real quick with things like natural antimicrobials, berberine, oil of oregano, using silver hydrosols, any other therapies that you would say that we can use instead of the antibiotic?
Yes, actually, I love those when we have an issue that's more topical, like periodontal issues. I like using I especially like using silver products.
Yeah.
Some of those can be very, very helpful, especially when we use the water pick and we jet them under the gum line. But when we're talking about a lesion it's intrabony, it's not just in the gum tissue, it's in the bone. Ozone can get to those, but the other products don't do that well.
Because isn't that the problem in the first place? Is that area is just not it's not well vascularized, and therefore, and even antibiotics sometimes can even fail to get into that area to control the situation.
No, positively, yeah. That's what oftentimes, and many times, the bacteria associated with these have become resistant to antibiotics. It's not uncommon to see a patient who's had a root canal treated tooth that's flared up repeatedly over the years be on multiple antibiotics, amoxicillin one after another, clindamycin one after another. So these bacteria become resistant.
What does the endodontist think when they see someone who had a root canal tooth who comes back in with an infection in that area? Do they have to just shake their head and say, "What am I doing? What is my career choice?"
Well, the problem is, what's happened, Jack, is we associate success with lack of pain. Root canal treated teeth most oftentimes are fairly free of pain. Now, not always. Patients, if you really ask a patient, now, can you chew on that tooth like you do all your other teeth, this root canal tooth? But no, I can't really well, what happens when you tap on that tooth? Well, it bothers me a little bit, but I can live with it. I'm fine. Okay, yeah. Well, that's fine. But many times a patient's not totally asymptomatic. I published a study on this very thing 5 years ago that showed the very best root canal treated teeth, the very, very best root canal treated teeth, when we submitted those to the University of Kentucky for a toxicology study. These were all extracted teeth on patients who had been referred to our office. 100% of those extracted root canal treated teeth, and these were the best of the best, perfectly done root canals, 100% of them had a high degree of toxicity. These are the best. And these were asymptomatic. These teeth, patients couldn't tell the difference between this tooth and any other tooth. So a lack of pain is not synonymous with success. It's not synonymous with success in cancer treatment. Most cancers aren't painful until they're end stage. It's certainly not synonymous with success in terms of periodontal disease or diabetes or most any other disease. Somehow we have begun, in dentistry especially, to think, well, if it's not painful, it must be fine.
Right. Same thing with cardiovascular, right?
Of course.
Nothing's ever really painful for us until the very end.
Yes.
So now we decided that that there is inflammation, there is illness. We think it's related to the root canal tooth, and we decide to have it extracted. What is the protocol for the extraction? What are the things that the dentist needs to do during that extraction?
I think it needs to be I think the dentist needs to be skilled at removing teeth. And so many times that's best left to an oral surgeon who does that routinely. We want them to clean that side out real well. And probably one of the biggest game changers for us, Jack, in the last 10 years in terms of getting these extraction sites to heal properly. In my opinion, the biggest game changer has been the use of platelets. We love to concentrate a patient's platelets. We draw extra blood before we do the procedure. We spin their blood down in a centrifuge, collect their platelets into a plug. It's called a platelet-rich fibrin technique. It's PRF in the literature, platelet-rich fibrin. And then we pack those platelets into the surgical site. And I've never seen anything heal like this in my life. We've been doing this for 6 years. It's just been a game changer. But oftentimes, too, in dentistry, when we take the tooth out, we don't take the time to really cure it out and get the infection out. A lot of people think, and I think it's important, too, to clean out what's called the periodontal ligament, which supports the tooth to the bone. So cleaning that out, then filling it with platelets is key. I like to even use other things. We love to use intravenous vitamin C because it's such a great detoxifier and because it speeds healing. I like to do other things like have an acupressurist or acupuncturist see the patient immediately after to reopen that meridian, to reestablish the energetic pathway. Dead teeth are culprits in blocking energetic pathways. These incredible meridians that God put in us were these wonderful lines of communication can get blocked when you have a dead entity.
Wow.
Yeah.
You mentioned oral surgeons. I mean, I had an oral surgeon to remove my wisdom teeth, which we'll get to in a minute. But, and when I asked, it happens to be a very close friend of mine's father. And I said to my friend, I said, can you ask your father if he cleaned out or if he took out the periodontal ligament? Yeah. And the response came back, said, I don't remember, and who cares?
Yeah, exactly.
So, I mean, but obviously, just like anything, whether it's a cardiovascular surgeon, a brain surgeon, or a dentist, it's about your brains, of course, but it's about your hands. How do we find, I'm sure there's some oral surgeons out there that you wouldn't trust to operate on a mouse, let alone on a human's teeth. So how do we decide? I mean, you're not an oral surgeon, yet you do this stuff every day, right?
I do it by default.
Yeah.
I do it because I visited years ago with my surgeons, my oral surgeons, that said, I'd like to follow this protocol, but they were very resistant to it. Interestingly enough, they've become much more amenable to this because it's more common in the literature and people are more aware of the fact that we need to clean these areas out, and it's very helpful to put platelets back in. But no, I do it because I had a lot of extra training doing mission work in Central America and removing lots of teeth, and I felt comfortable with it. And then I began to see the benefits of doing this in a way that I was exposed to when I got sick myself. And I said, you know what, I can't go back. This is what I've got to do from now on. So there are many, many dentists who do this beautifully. And I think more and more oral surgeons, in fact, we're having more and more oral surgeons join the International Academy of Oral Medicine and Toxicology because they say, well, by golly, you know what? There is something to this fact that when teeth are removed, it doesn't always heal. Sometimes it precipitates into what's called a cavitation or osteonecrosis of the jawbone. And we want to prevent that at all costs because now you have another chronically infected area. So
okay. Before we get to cavitations, what's kind of some of the best maybe prep work that somebody would do, I guess, and this goes back to also the amalgam, if they're going to have the amalgam removed or if they're going to have a root canal tooth removed, how should we best prepare ourselves for that? And then also what kind of aftercare, what are some of the strategies to use?
Well, I'm it's very fortunate in that I have many physicians like yourself who help prepare patients before they have something like this done. If if the mercury fillings are removed properly, the patient's not going to have a mercury exposure, and they should do very, very well. The flip side of that is once you don't have a 24/7 mercury exposure, your body can start to detoxify, and a patient can have some bizarre, maybe flu-like symptoms, even though they didn't get exposed. They're becoming re-exposed or retoxified as the body begins to get rid of the heavy metals. That can happen. So it's nice to have a patient being seen by a healthcare provider who knows how to recognize that and maybe give some patients some gentle things to help bind those metals and to help eliminate those metals. Typically, those are eliminated through the feces, some of it through the kidneys. And then in terms of what can someone do to help get these bony areas to heal properly when they're operated on or when teeth are removed, there's nothing like leafy green vegetables to help build good bone. I love to see patients on a beautiful, healthy green vegetables, especially follow their ancestral diet. Mm-hmm. Okay, follow that diet where you feel robustly healthy, where you feel like you can eat and run a 400-meter dash an hour later. That's what I want to see. I want to see a patient eat like that, and they will have their body prepared in advance. That's really all we need in terms of, now if I see a patient, as we do, so many who are chronically ill or who have Lyme or who have so many different autoimmune issues, I really do like to see those patients supported by a healthcare provider who's helping them with their sleep, who's helping them with their nutrition before they get to us. It makes everything easier.
Fantastic stuff. This is so amazing and so needed for people to hear this kind of information. This is so huge. And obviously, Stuart Nunnally, practicing holistic dentist outside of Austin, Texas. I would assume obviously you've got books, you've got materials, you've got videos, and of course you got a thriving practice down in your area.
Well, we are. We're incredibly busy, and we love the part of the world that we live in. It's a beautiful rural area, and there are parts of the world that do still have fairly clean air and clean water, and we're in one of them. And so we love it for ourselves, and we love it for our patients.
So now the root canal tooth is removed, and my choices are I leave the area, and so the PRP and the things you do, number one, you want to make sure that the bone that's left, you do strategies, techniques to increase the bone growth and to make that as healthy as possible. And then you can decide on an implant, and there's two different types of implants, right? The zirconium and there's titanium implants, or you can do some kind of bridge or other appliance. Let me say this. If you are going to go for an implant, it always blows my mind when people basically they're gonna do a root canal tooth removal and then they're gonna do an implant. Is it possible that it's recommended to do it same day or like the next day that the dentists are doing this?
There are many who do, and actually there are some implant dentists who I really admire who feel like and who do get good results doing that. I think it's because they clean the sites out so well. One of my dear friends in Munich, Germany, does this routinely. And I see his patients sometimes from the United States, and their implants seem to heal flawlessly. So I think, again, Jack, it's a matter of who's doing that treatment and how comfortable they feel doing that procedure. Most of the implant dentists that I work with in this country like to have a healing time after you have a tooth removed. And the reason is the area from around an infected tooth becomes very acidic. And when you have an acidic situation with a low pH in the bone, it tends to dissolve bone rather than create new good bone. And so we want to make sure that that's resolved before the implant is placed. I think still most dentists would would use that particular treatment method where you remove the infected tooth, wait a few months, come back and put the implant in. But I have seen it done otherwise, and quite frankly, to my surprise, most times it seems to be working.
Mm-hmm.
So in my own mouth, I would opt to have the tooth removed, let a period go by, and then come back and have the zirconia implant placed.
Okay. And as a cardiologist, I guess I would say I would agree, because that only makes sense. I mean, I've seen people, for example, and they've got upper and lower dentures, and it's not the old time dentures that my grandmother had, where, they were removable. I mean, these are the ones that are, screwed into the post that's inside the bone. And those bones are, those bone posts were very inflamed, and therefore the post had to be removed. And then the same day they were going to put a new post, and I just said that doesn't jive. And he chose to follow my advice, and he's doing well.
I think that's smart.
Zirconium versus titanium, and let me say this: there is a holistic dentist that I know in my area where I practice in Arizona. And her opinion is that I guess something happens with the zirconium where it just, I don't know if it starts to break or it starts to crumble, it starts to fracture. And she says it's impossible to clean out. She said it's even worse than mercury. But maybe just give me your 2 cents on the reality of that situation.
Well, I have had to remove some zirconia implants, and it's not a fun part of the day because they're not easy to get out.
Yeah.
If they fracture. The truth of the matter is very, very few of them fracture. So I understand her point. To me, I honestly wouldn't have a titanium implant. And it's not because titanium, I mean, we know that titanium has been used as a prosthetic device in joints for years and years. We still don't know. There's no good study that shows what the health impact has been of all these titanium devices. No, we just don't know, but we do know more and more. There's more data in the literature about toxicity associated with titanium. And the fact is, most titanium implants are not pure titanium. They're alloyed with other metals that can be a real health issue. So I have an issue with titanium implants because of that, and because of the fact that they can block these beautiful energetic channels, again, that I spoke about a while ago. If they're on a meridian, for example, that is on the same meridian as your gallbladder, I see this frequently. People can have issues then, digestive issues, because of gallbladder issues. And we, interestingly enough, people who are skilled at testing this, who are skilled at testing for these wonderful energetics, will say that zirconia does not have that same impact. So to me, that's significant. It's not significant so much in Western medicine. We just don't acknowledge that. But the Eastern medicine people would say that's more important than any bacteria ever. These energetics are incredibly important. So I believe I've seen it over and over in the years that I've been practicing.
So how do we decide? Okay, so if we decide, okay, zirconium is the way to go. If we're going to do an implant, but how do we decide? Should we do an implant or some kind of appliance?
Well, that's a patient by patient decision. There's not a one size fits all there at all. In my own mouth, let's say, for example, I had a tooth removed, and the 2 teeth on either side of that tooth, let's assume it was what's called the first molar. So I now have a second molar behind it, and I have a tooth in front of it called a bicuspid, and one missing in between. If those 2 teeth happen to already have crowns on them, well, this is a no-brainer for me. I simply take those crowns off and make a bridge, because I don't have to do anything more invasive to those teeth. They've already had the invasive procedure done when they had the crown done. All I do is slip those off. I make another new crown on each of those 2 teeth with a false tooth in between, bond that in, and that's a bridge. And then the patient does not have to go through another surgical procedure to have an implant. What if those two teeth have never had any treatment done on them and I'm missing a tooth in between? Now, would I grind two perfectly good teeth down and put crowns on them to make a bridge? I would not. To me, that's far too invasive. In that case, I would do an implant, but I would only do the implant, zirconia or otherwise, on a robustly healthy patient. I would not put that implant into a patient who had an autoimmune disease, who had Lyme, who had any other degenerative disease where I felt like I was going to impact their immune system negatively or challenge their immune system. So I think we should do implants on a patient-by-patient basis.
Does it matter the location? I mean, so if someone like we mentioned the movie, if they've got one of their front teeth, maybe that's more likely you would do an implant to one of the front teeth because maybe that's I don't know it's so important maybe for the bite or whatever as opposed to something towards the rear.
Yes. So I have a tooth that I took a blow to in a car wreck. It's still a vital tooth, but I think at some point, honestly, that tooth may die.
Yeah.
If that tooth dies, I'm certainly not going to do a root canal on it. I'm going to remove the tooth, but I don't want to grind my two beautiful teeth down on either side of that for a bridge. I would in that case. In my case, since I'm doing so well health-wise, I would have a zirconia implant placed. Great point, Jack.
Yeah. Okay. Okay. Tell me, so there are certain holistic doctors that think basically, and I know my wife pushes this on me as well. She's like, okay, the first thing you got to do is address the teeth. She's like, when people come in, you're not even having a conversation if they got mercury, if they got root canals. My wife, as a chiropractor, feels so strongly about the teeth. Mm-hmm. And then, of course, I've been to conferences where, especially some of these holistic cancer doctors, they say the first thing that's going to happen, you're getting a cone beam CT.
Yes.
To look for chronic infections and to also look at the cavitations. So explain again what the cavitation is, the importance of it, and then we'll talk about what to do about the cavitations.
All right. Well, a cavitation is typically an area in the jawbone. The jawbones are the most common bones for cavitations to develop in, but they're not the only bones where cavitations develop. A cavitation is an area in a bone that has a very sluggish blood flow or no blood flow. It may be completely necrotic or dead. And that area is filled with typically with anaerobic bacteria and their toxins. That's what it is. It's a little cesspool of bacteria that get to live in this wonderful warm environment and does not have much of a blood flow there to come deliver the body's own immune defenses to it. The jawbones are common because when we remove teeth, first of all, jawbones don't have a great blood flow to them. So when we remove teeth, we as dentists typically use anesthetics that have a compound that's known as adrenaline to most people. To us, we call it epinephrine. And anesthetics with epinephrine are used because they make the anesthetic more profound and they also keep the field more dry. They help shut down the blood flow. When you shut down the blood flow to an area that's just been traumatized, you have a recipe for disaster. You do not get the blood flow to these areas that we need, and so people end up with what's called a dry socket. Very, very common thing that happens. Usually it happens in the wisdom tooth area, the third molar areas. When it happens there, by the way, that happens to be on the heart meridian. Yeah. So when we see these, what they look like is literally this, Jack. It's very interesting. They look like an oil slick when we open them up. And the reason is inside a bone, when you get an anaerobic or dead area, you develop a preponderance of degenerative fatty cysts. The whole area will be, bone marrow is fatty anyway, but when the area becomes necrotic or it has no blood flow, when it becomes anaerobic, you get this whole area filled with degenerative fatty cysts. And so when we open these up, we make a small incision, we lift the outer surface of the bone off, and then we clean this area out. It literally can look, usually does look like an oil slick. We clean that out, irrigate it well with sterile saline and ozonated water and those sorts of things, fill it with platelets, and then you can get these to resolve. So a cavitation is typically an area in the jawbone, which I think most oftentimes is caused by us as dentists using too much epinephrine when we do the treatment to remove the tooth.
Okay, and obviously, I mean, so this would be something that's very common with wisdom teeth removal. So every new patient that I see, we take that intake, you know, with them. Did they have their wisdom teeth removed? Which is what I mean, like 95% of Americans these days have had their wisdom teeth removed. Like whoever built us, God, evolution, whatever you know, subscribe to, they made a mistake to give us the wisdom teeth. Which obviously is eloquently explained by Weston A. Price, is that when your mother ate drank coffee, smoked cigarettes, and ate coffee cake, that while she was pregnant, that's going to lead to a child that will have a small crunched up mouth where the teeth are all condensed and therefore malformed and on and on and on.
Yes.
What should everybody have their wisdom teeth cavitation, or their wisdom sockets cleaned out because there's definitely cavitations there, there's definitely infection there, or is the cone beam the arbiter that decides?
Well, that's like asking, should everyone have his root canal treated teeth removed? And I would say that some people, again, tolerate the toxins associated with cavitated areas pretty darn well. Because when I give a lecture to a room of 500 people, probably 400 of them have cavitations. That's the truth. Yeah. Now, many of them have all sorts of systemic health issues that no one has ever considered it might possibly be a jawbone lesion. Okay, so we just don't know how prevalent these systemic health issues are a result of, say, jawbone lesions. I will say this, Jack, that after doing this treatment now every day, virtually almost every day of my practice for the last 16 years, I've been cleaning out these areas. I've seen some of the most dramatic changes in people's health from that procedure alone. Than I have anything else. And so what do? I tell patients when they come to see me, if someone like you has not already informed them of these possibilities, I say, now listen, I can see areas on your cone beam that look like they are necrotic in your jawbone. They may or may not be contributing to your health issues. We just don't know, because the toxicities associated with these can go anywhere. And they may not have anything to do with your illness, but I just say to them, I can see them. I think it best that we clean them out. I think there's great data to show that we should clean them out. And I leave it up to the patient. I never want to be strong arm a patient, but the problem is, see, we in dentistry, those of us who do this procedure, sometimes we're maligned for doing the procedure. The problem is there are a lot of people out there not doing the procedure who never inform the patient that it could be a problem. Now, to me, I think that's more of a liability, much more of a liability. You mean you can see a lesion on the mandible or maxilla, but you're not going to tell your patient about it? And it can have all kinds of systemic health issues, like an increase of pulmonary lesions, like an increase of brain lesions, like an increase of thromboembolic, like an increase in deep vein thrombosis as a result of having a jawbone lesion? Absolutely. So
Listeners of the Healthy Heart Show, we're talking with Dr. Stuart Nunnally, and we're just getting so many pearls, so many gems. I know you're out there. I know you're listening. I know you're scared by this conversation, and you should be. But the good news is there's answers, and there's doctors out there like Dr. Nunnally that can help you get through all this stuff. And if you, whatever your health issue is, cardiovascular or otherwise, certainly look to the teeth. Amongst many things, but nothing more important than teeth for this issue. Now, obviously, we need to go to a quality, holistic, biologic dentist that believes that cavitations are a problem. And I tell that to people too. I'm like, go, find a doctor who says, I never do mercury amalgams. I haven't done it in 15 years. It's a travesty what we've done. I accept that I've been part of that. But now I'm part of the solution, as opposed to going to a doctor who's like, well, I don't think it's really a problem, but if you want to have it done, go have it done. But Doc, how do we make sure that we take care of the cavitations appropriately?
I think you have to interview the dentist. And of course, a good place to start is that IAOMT.org organization, because many of the dentists in that organization are either familiar with the procedure and know where to refer patients, or they're doing the procedures themselves. When I had mine cleaned out, Jack, probably 20 years ago, I went to Montreal. There were probably, I'm telling you, there may not have been more than 50 people in the world doing the procedure. And now there's thousands of us who do the procedure. So it's not that difficult, but I would say most dentists, even holistic dentists, don't do the procedure. Maybe they're more specialized in the area of taking care of heavy metals or that sort of thing. So it's one of those things where you just have to make the ask. You have to call and say, hey, is this something that your dentist does regularly?
All right. I do have a million more questions, but I'm going to I'll do one more. I'll do one more scenario, which is obviously very important. This is the concept of the routine dental x-ray. And my father was a very successful cardiologist in Chicago who in his mid-50s became depressed. And the depression didn't respond to pharmaceuticals. And eventually we take him to the Mayo Clinic, and the Mayo Clinic diagnoses him with PSP, progressive supranuclear palsy, something very similar to Parkinson's. No treatment. The Mayo Clinic has no idea why. I mean, you and I can talk all day long about why my father got this, but the Mayo Clinic, they have no idea why. Mm-hmm. But my father, as a cardiologist, was exposed to a lot of radiation, ionizing radiation in the cardiac cath lab. And so was I, as a cardiologist, doing pacemakers, angiograms for all those years.
Yes.
So when it came to me and learning all the things that I know now, and then I go to a holistic dentist in Arizona, and that holistic dentist sees me and says, Jack, we got to do a set of x-rays on you. And I say, listen, I don't want to do that. My father died of this neurologic disease. I've had enough radiation in my brain. My teeth are pretty good. In fact, I'm just here for a cleaning. Can we go without that? And he said, well, Jack, what if someone came to your office and they refused an EKG? What would you do? And I said, well, me personally, that's their choice. And if there was something they did that I did not agree with, maybe I would have them document that and say, listen, I am refusing to do this particular procedure. And he said, well, I don't do that. If you will not accept x-rays in my office, a well-known holistic dentist in Arizona, who I'm sure you know, if you do not do this, then you can't be my patient. And I said, bye-bye. And I walked out.
Right.
Why, and not to mention children that get routine x-rays. That's a whole, we're both going to agree, you as a grandfather, me as a 3-time father, that we're never going to do that. That we're in total agreement with. What about, I'm 48 years old. My teeth, I don't have any symptoms. I'm there for a cleaning. Why do I need an x-ray?
The only reason would be because some dental infections are occult infections, and they can't be seen without a dental x-ray. And let's say you had an abscess. Let's say you had a chronic apical periodontitis. Maybe you were never aware of it, but maybe as a child, someone hit you on your molar, and the molar necrosed or died, and it's been sitting there latently all these years and never gave you an acute problem, but it's a chronic abscess. It's chronically infected. And what if then you did have a systemic health issue as a result of that, and it wasn't picked up? It could have been picked up by an x-ray. I can see the reasoning. I can see your reasoning, of course, because I see it daily. And we have a patient basis, much like you, who are very, very well-educated people who are honestly, if they hadn't taken their health into their own hands, they'd be struggling or dead.
Yeah.
So I understand that. And so what we would say to you, if you came to us and said, I'm not doing an x-ray, I say, brother, go for it. I'm all for you. I'm going to document it here because, again, we have to be in this litigious society. We have to say, you know what, Dr. Wolfson didn't want x-rays. Let's honor that. We're going to take care of him anyway. I might say, Jack, there's one tooth. It concerns me. Would you allow me just to take one picture of that tooth? And then you and I could have a conversation about it. But we would never want to, again, strong arm somebody into taking x-rays who doesn't want it. It's your body.
Okay.
Yeah.
Fantastic stuff. Anything else you would like to mention we could talk about we can talk about sleep apnea. We could talk about, periodontitis and scalar planing and all these other things that I've been told I needed in the past where I'm like, I don't know. But with all due respect to a lot of those dentists, everybody, I would assume most people are just trying to do their best. They're not like us cardiologists who love to do things just for money. We love to do stress tests for money. We love to put in stents for money. We love to do, all kinds of different devices that we get reimbursed for like crazy. It's totally true.
Well, Jack, here's the story before we get off the air. And I tell this to virtually every group to whom I speak, especially lay people. The least amount of dentistry, the better off you are. That's just the truth of it. I don't take, I don't take it lightly what we do because, quite frankly, people are paying me oftentimes to reverse what's been done before in my profession. And to me, that's a very sad thing. I don't take that lightly, and I'm sad about it, honestly, sorry about it. But the truth of the matter is we're moving forward. We learn as we go. And I hope we're doing things even much differently 10 years from now than we are now. And we're just trying to do our very best as we go. And I think just as you said a while ago, lots of procedures are done in medicine that are unwarranted. The same is true in dentistry. I don't like to admit that, but that's the truth. And so if you, as you know, there's nothing like getting with a healthcare practitioner who you bond with and who is just telling you the truth and trying to give you the latest data and just share the truth with you. And that's a wonderful relationship. I hope that's what I want my patients to experience.
Fantastic. How do our listeners find out more about you?
Well, pretty much if you Google Stuart Nunnally, you're going to run across me someplace or another. But my website is Healthy Smiles for Life, healthysmilesforlife.com. And I'm just outside of Austin, Texas, in a little town called Marble Falls, where my wife and I grew up. And we love Central Texas. I love your part of the world, though, too.
Absolutely fantastic. Fantastic. All right. We'll call this episode a wrap. I'll let Dr. Nunnally get back to saving lives through the mouth and other techniques that he uses. I'm Dr. Jack Wolfson. This has been a fantastic episode of the Healthy Heart Show. We will see you next time.